Thank you, everybody, for having me today. I'm Cheryl Toner. I'm the Director of Food Sector Engagement for the American Heart Association. Relatively new in this role. I've been on board with the American Heart Association since April 1st, but really happy to have had the opportunity to work with many of you over the years. So this is a new role, but hopefully we'll continue to do good things together. I'm particularly wanted to shift the title of my talk a little bit to emphasize that the American Heart Association is making some shifts in how we do this work, in not sodium reduction efforts alone, but in how we look at the food system and in how we operate in the food system. So I hope I can give you a good sense of where we're going with things today. As you all know, American Heart Association is one of the oldest and largest voluntary organizations really working to reduce the death and disability from heart disease and stroke. But we are really on a mission to be a relentless force for a world of longer, healthier lives. And that's a broad statement that conveys that we're not that we're not focusing on heart disease and stroke. The absence of those words doesn't mean that, but it does mean that we are focusing on overall well-being. We're focusing on more than the absence of disease, because we know that when we think about what makes a healthy life, it's about more than the absence of disease. It's about, and it's about more than getting the right treatment or early detection or diagnosis. Those are all very important, but the environment that we live in, that culture of either disease or health, really makes a difference in people's ability to be able to take advantage of or be able to live that healthy life that we want them to live, that they want to live. So you'll see, around this diagram, healthier, I don't know if you can see my arrow, but healthier schools and childcare, healthy families, improving healthy eating is down there on the right. But you've also got all of these other things. There's hospitals involved, there's people's workplaces involved. So we're trying to really do our best to be mindful of that entire environment that people operate in, that people work, live, and play in, and be a part of improving that so that people really can take advantage of that healthy life that they want to live. And similarly, when we think about food, it's about more than the nutrients, right? We've talked about that today. It's about more than even the food. It's about people having equal access to the food. It's about food being produced in a way that's sustainable for the environment. And so we're trying to be very mindful of that entire foodscape and everything that influences people's ability to access and make choices that are consistent with a healthy lifestyle. So I'm going to give you a little bit of background on what American Heart Association has done around sodium reduction efforts to date. And then I'll talk a little bit about that shift that I mentioned earlier. But we have several key, they're kind of steps, but like anything, it's never a linear process. It's always a little bit of, a little bit forward, a little bit backwards, a little bit of trying to readjust over time as we learn new information. But we do lead and evolve with the science. Science is ever evolving, so we have to evolve with it. We integrate sodium and the science behind it into our policy efforts. We work to drive consumer demand for lower sodium foods and for a healthier diet overall. And we're engaging and collaborating with industry throughout that process. Everybody's said it, and I'll say it again, it's absolutely critical that we engage and collaborate with industry. We cannot, in the public health community, just point the finger and say, you've got to do better. We have to actually partner and work together. And then, we also have to analyze and evaluate how we've been doing and feed that back into our system, into our approach, so that we're always evolving our approach. As much as we evolve with the science, we have to evolve our approach as well. And think about whether what we've been doing is working or if we need to try some new things. If it's working, keep doing it. So in terms of leading and evolving with science, this is a busy slide, but I just wanted to give you an idea of the kinds of ways that the American Heart Association helps to fund research. So we do that through some competitive grant programs, including partner programs with industry. We have strategically focused research networks that actually we basically fund groups of research institutions who work together on different aspects of a particular problems. So we have these strategically focused research networks in prevention, in hypertension, in disparities, Go Red for Women, and on and on. So you have these groups of 3 to 4 research institutions that are tackling the problem from different angles. We just recently closed the request for applications for a new cardiometabolic health SFRN, and one that will be opening soon is on health technologies and innovation. So you can take a look out, keep a lookout for that. Little arrow there, so in the busy slide you can see where that is. And all of this is, we also have an Institute for Precision Cardiovascular Medicine, which is focused not only on drug discovery and that sort of thing, but also on prevention. So really collecting a lot of information, baseline data on genetics, environment, and lifestyle, and how all of that works together so that we can move forward more rapidly. We also have an initiative called One Brave Idea. It's a partnership between American Heart Association, Verily, and AstraZeneca, and really looking at understanding the earliest stages of heart disease as we think about true prevention, understanding that very early stage of the disease so that we can do a better job of prevention. So when we think about leading and evolving with science, of course, it's not just funding research, it's also monitoring and evaluating what's out there, everything from the dietary reference intakes reports that we've heard about today. I was going to say this morning, but we're beyond this morning now. The published literature, that sort of thing. And we have volunteer committees in a range of different areas. Of course, we have a nutrition committee, but we also have epidemiology and lifestyle committees. We have hypertension committee. We have a range of different groups that will monitor and help us to stay on top of where the research is at and how to set priorities moving forward. Where do we really need to take a new approach or update our recommendations? So they're taking all of that external information into account. We'll sometimes engage in stakeholder dialogue, and in sodium in particular, we've done this really pulled together a group of stakeholders from academia, from industry, from government to talk about ways to reduce the population-wide sodium intake and decrease sodium in the food supply. So we're not the only ones who've done this, but took place in 2013. And that kind of thing is really important for us to be able to not only consider the science, but consider feasibility of the recommendations that we're making. And then there's a little bit of a typo here, but published reviews on evidence, methodological issues, et cetera. That particular something that we've done related to sodium is published in 2014, a review on some of the methodological issues around cohort studies that relate to sodium and cardiovascular disease outcomes. So our nutrition committee is looking for ways to help provide some context around some of the challenges and in interpreting the research as well. Most recently, the American College of Cardiology and American Heart Association published our latest guideline on the primary prevention of cardiovascular disease. And I'll just share this table that summarized all of the different dietary factors that this group determined was important for reducing risk of cardiovascular disease. And one of the things that's missing from this table is very particular quantitative targets. Really what you see here is recommendations around emphasizing favorable food groups like the fruits, vegetables, legumes, nuts, those kinds of things, lean protein and fish, whole grains, replacing saturated fats with unsaturated fats. And there is a mention of reducing the amount of cholesterol and sodium, but not particular numbers given in this particular document. Minimizing the foods to minimize, and trans fat kind of being the strongest statement there to really avoid intake of trans fats. So I raise this to say that it's really a prevention guideline that takes a total diet approach. There's a strong emphasis on food groups, not just individual nutrients. And there is I think a reliance on other dietary guidance that's out there to kind of give you those numbers that are necessary for people to really know how to apply this prevention guideline to their own diets. Yeah. Oh yeah. So I'll send you the prevention guideline. I'm gonna forget all of the acronyms, but basically, I can't remember what the BNR is. I apologize, but I know that on the left-hand column is actually the grade of evidence, and so with the red being, of course, the highest level of harm. So green being, yeah. But I'm gonna send you the paper so that I don't mess that up for you, and I can pull it up if we have time during the Q&A. So we also integrate the science and the sodium and the science behind sodium into our policy efforts. And so our policy team shared with me some of the things that have been done over the years that have specifically been related to sodium. So obviously sodium's an important part of standards for school meals, menu labeling, the nutrition facts panel, the voluntary targets that Andrea mentioned from FDA, and then have been involved in some efforts at the local level as well. And moving forward, some of those same things are still a priority. Child nutrition reauthorization, including school foods, the FDA Nutrition Innovation Strategy, which includes those voluntary targets, the dietary guidelines for Americans, and obviously Farm Bill and SNAP SNAP benefits. So sodium just being integrated into all of that as we move forward. We also work to drive consumer demand. The American Heart Association has a lot of credibility with the consumer, and so we do take that very seriously, and we work to bring science-based messaging to the consumer in a way that they can really utilize that information to make positive changes and help to motivate them. So we've done a fair amount of consumer research, and we've already heard some of the results of various studies today. Nothing inconsistent in what we're finding. People are they're thinking about sodium. It's not huge majorities of the public that are really thinking about sodium, but people are thinking about it. And those who are thinking about it want help. They're really making an effort to keep sodium in check. So what can we do to help them? So in 2014, 2015, American Heart Association had a campaign, a sodium campaign, to really increase awareness, to really inspire consumers to make changes. So we were asking consumers to take the pledge to reduce sodium. And we also had a grassroots advocacy campaign. Now we had over 70,000 letters that were sent from consumers to decision makers and food companies around asking them to reduce the sodium in their food products and also in restaurant menus. But the Take the Pledge campaign was not as successful. So although we were really encouraging people to make a personal commitment, we weren't really getting people to at least, kind of click the buttons and really go through that process. But our resources on our website are highly popular in terms of really engaging people in everything from videos to recipes or what have you. So we see people interacting with these resources on our website, but fewer people who are willing to take that pledge. So we launched in 2016 this Healthy for Good initiative and really tried to do more to help inspire people and use the consumer research data that we had to really understand what would help people to really be motivated to make changes. So we tried to obviously base all of our information on science in terms of what we provide to consumers, but also encouraging them to think about what would be personally motivating to them, helping them to find their own why. We provided easy to understand advice, tools, tips. They could have really actionable things that they could do, actions that they could take, and tried to think about ways to incorporate this in a lot of different venues. So not just online, but working with companies to incorporate it into corporate wellness initiatives and that sort of thing, community health organizations incorporating it into their programs. And they're pretty simple. It's a pretty simple set of categories, really, that we try to touch on. Eat smart and really emphasizing the total diet. So yes, sodium's a part of that. Added sugars are a part of that. It's also about getting the food groups that we need for nutrition. So fruits, vegetables, whole grains, low-fat dairy, and so on. Adding color, and that's where we get into a lot of the fruit and vegetable messaging. Moving more, helping people to find something that they enjoy that will get them moving and enjoying that part of life. And also being well, and this is something we've had as an increasing focus at American Heart Association, is the importance of emphasizing mental health and well-being, that people really need an opportunity to relax a little bit about, health, issues of health, and make it more positive and more enjoyable for people. And encouraging people to take part in self-care is another important aspect of that. So finally, we do engage and collaborate with the food industry and have been doing so for quite some time. In 1995, the Industry Nutrition Advisory Panel, or INAP, was established. And really has worked over the years to tackle issues that the group has identified as important, things like trans fats and added sugars. In 2015, we partnered with Aramark in an initiative called Healthy for Life 20 by 20, in which we worked directly with Aramark. They set goals to reduce sodium and added sugars in their menu items, menu offerings by 20% by 2020. And so really looking at, we're coming up on, kind of the fourth year, I believe, of this relationship, and really using it as a model for how to really make big changes with a company that has influence in a lot of different markets as a food service company. We've also been convening our Healthier Food Leadership Summit since 2016, where we bring together not only industry but academia and nonprofit organizations to really talk through some of the issues and identify a clear path forward. I would say that the biggest benefit that's coming out of this for American Heart Association and hopefully for our partners is that we've really been trying to listen carefully to what are the real issues and what are the real places where we can make a difference. And it's really helped us to understand the need to emphasize workplace health, for example, so we've increased our programs in workplace health. We've also heard that it's important to help companies understand the business case for healthy, which is not an issue for every company, but there is a small number. I think a lot of companies have fully engaged in the business and understanding and accepting the business case for healthy. They've been able to realize and even build that case with their own successes. But there are some companies who are still sort of not bought in. And then finally, I would say that these summits have been really important in helping us to shift our thinking towards that beyond looking at individual nutrients or even looking at only the diet and thinking about the entire food system and how we can help to be a part of encouraging change there. That's okay. So you can go to the website and look at it. Let's see if I can go back to So, but it's really the places and spaces where food is grown, manufactured, marketed, acquired, prepared is how we talk about food and how we give food meaning, what people are actually consuming. So it's everything. Someone mentioned earlier innovations. I think it was you, Andrea, mentioned innovations around marketing and how people talk about, how a company may talk about food and market food to encourage healthier choices. So it's not just the food product, but it's everything around the foods that we're providing to the public. So we're really working and have developed the Foodscape Innovation Initiative, where we're trying to encourage innovation in the foodscape that will help us to move towards a sustainable food system, to move towards nutrition security, so not just enough food, but food that's actually nourishing and healthful for people, and really for all. Really a food system that's equitable so that everyone has access to those healthy foods that will support their health. So we're listening, we're convening, we're trying to inspire and recognize good work. I'll talk a little bit about how we're doing that. Leading collaboratively, we're trying to really think about where are the places where we need to help to fill gaps that others are not already filling, but also think about where others are already doing great work in the foodscape and how we can be supportive of that. Continuing to work to drive consumer demand, and also continually evaluating our progress and evolving as we learn more. So our nutrition committee released an advisory to help us to understand kind of where we were at with the the idea of innovation in the food system and what's really been working and where do we have evidence for what's working. And what they found was that we don't have a huge amount of evidence around what's working and working well. But they did try to give a grounding in terms of what a healthy food system would be and what a sustainable food system would be. And these are not things that would be surprising to anyone here. But they talked a lot about the importance in the advisory of a multi-level approach that really includes all of the stakeholders that have a role to play in our food system. So really looking at everything from policies at all levels, food industry, engagement and activity, public health and medicine, community workplaces and work sites and schools, and also what the individual can do, individuals and families in particular. So emphasize the need for all of these systems within the food system to work together. I'm going to just skip over this, but let you know that in the paper there are definitely some ideas around different things that can happen at all those different levels. And there's also a review of the evidence that does exist around different approaches that have been taken in the food system to create better health and sustainability. The big thing that in terms of the advisory that really has been fueling us is that they really emphasize the importance of generating research and evidence, linking innovations to health outcomes, the underlining doesn't look like it's exactly right here, but promoting transparency and availability of data, whether it's on products, consumption patterns, or marketing, to help us to understand the impact on behavior and health. So really helping to pull the data that's out there together so that we can get a better global view of what works well and what doesn't work well. And I'm going to take those underlinings off because they make it hard to see since they're not lining up. And then facilitating the integration of strategies that will affect how we market foods and how we market or how we develop products. Really trying to bring the different sectors together so that we can work together on initiatives to obviously move us towards healthier dietary choices by individuals. But importantly, in all these three recommendations, they also talk about partnering. So again, we don't do it, none of us can do it alone, no individual company, no agency. We have to partner with each other to make significant progress. So that was a really strong theme throughout all of their recommendations. We launched as a result of this, the work with the summit, as well as our advisory, the Foodscape Innovation Awards. And this is our effort to try to recognize good work that's being done in the food industry and hopefully to inspire others to do more of that kind of thing. So we actually have this awards program open for submissions through September 16th. And it's one step in that process, but it will be an annual award. We're also convening our summit again this year, and we've renamed it from the Healthier Food Leadership Summit to the Foodscape Innovation Summit. Really wanting to bring together, again, industry, academia, nonprofits, different folks involved in the food system to work together in a collaborative learning environment, to have engaging panels to really talk about data, insights, and trends. Really challenge us to think outside the box about what some of our challenges and opportunities are related to the foodscape, but also work together in discussion groups to really tackle some of the issues that could move us forward. And then finally, our Industry Nutrition Forum is a new name for our formerly the INAP, the Industry Nutrition Advisory Panel. Really, it's the group, like I said, that's been around since 1995. It's been a core group of industry that's really worked to help us to identify key issues that are really conducive to collaboration and helped us to move forward on things over time. We try to offer thought-provoking symposia where the industry can come together and our volunteers can come to the table and they can talk through some important issues of the day. But we also are working to build more collaborative opportunities into the Industry Nutrition Forum so that it's not just an information exchange, but it's actually an opportunity to roll up our sleeves and work together on various issues of concern. So really, we've been working for decades to tackle things like sodium, and I think our policy efforts have been the most visible to the public, or visible to the public, the industry, and others. But our efforts to drive consumer demand have also been really critical in all of that. We've talked about that balance a little bit between, do you change the food supply, do you change consumer behavior? And the answer is probably both. That we have to do both, and we have to continue to fund the research, understand what needs to be done from a science perspective, what the healthiest diet is going to be for people, how do we elicit behavior change and really sustain that over time, but also how can we make it easier for people with all of the choices and all of the challenges that they have from day to day. How can we make it easier for people to drive towards that healthier diet, and how do we do it together? So with our Foodscape Innovation Initiative, I hope that we're signaling and we'll really be able to work towards a shift in thinking about not just nutrients and not even just diet, but also the food system and how we can do better together to improve our food system. We really want to take a systems approach and not think in isolation about things that need to change, but think about some of the ripple effects that any change that we make can have in terms of the health of people and the planet. We have an ongoing commitment to work with the food industry. That's really the totality of my job, is to work with the industry and our public health partners together to try to move forward on these initiatives that are important to all of us. And I think we want to do definitely a better and ever improving job of evaluating and understanding what we've been doing that works well, and be a part of helping to generate that data that will help to inform us for the future, so that we can, if you're going to pick an innovation and go down that road, what's the best one? What do we know is going to work well? And where we don't have data, let's start generating it so that we can have more to go on for the future. So that's all for me today, and if you have any questions, I'm happy to take them.